This morning, a handful of states, including Georgia, Montana, Tennessee, Mississippi, and Colorado, have begun easing some of their COVID-19 restrictions. But many others are keeping restrictions in place, including Michigan, where Governor Gretchen Whitmer has extended stay-at-home the order until May 15th. And New Jersey, where Governor Phil Murphy says they are several weeks away from phase one of reopening. And Governor Murphy joins us right now. Governor, thank you so much for joining us. Give us your rationale, if you could, for waiting a few more weeks before reopening. And how is New Jersey holding up?
Thanks for having me on. We're hanging in, but we're still in the thick of the fight. So, we're still at this point where positive tests are going up. The curve is flattened. That's good news, but they're still going up. Fatalities, sadly, we're almost at 6,000. And then in the hospitalizations, intensive care units, those numbers are looking more encouraging. Hospitalizations are coming down, intensive care units down slightly, ventilator use down slightly. So we think we're beginning to see some light here. But again, we're still in the thick of the fight. We are going to announce later today, and we're working extensively on what the principles should be that guide any steps we take toward responsibly reopening. We know we need a lot more testing. We know we need the contact tracing. We know we need an isolation plan if someone is deemed to have got it, and to try to prevent more community spread. So we know what it looks like, but I can't marry myself yet, given the data that we're looking at, to any timetable.
And what about supplies and the ability to treat the ill, and also the ability to keep up with the demand for medical professionals fighting the virus? Where are you with that?
Still in the fight, without question. We have the constraining factors are bed capacity, personal protective equipment, ventilators, the medicines that you need to run those ventilators, healthcare workers. We have been, since January, wargaming this. We have been able to stay just out ahead of all. Our healthcare workers are heroic, but they're beaten to a pulp, as you can imagine. We put a call to arms out for volunteers. That has begun to work, thank God. Our bed capacities are holding. But we're also cognizant of a reality here that a lot of the experts will remind us of, and that is, this is a big fight, but it may not be the last fight. So even if we do everything right on reopening our state or our country, this sort of virus has proven in the past that it can come back at you. So the capacities we're building, whether we need them this month or next month or maybe 6 months from now, I'm not sure, but I'm happy we've got them.
Well, Governor, if you look at the history of the 1918 pandemic, you see that cities that opened up too soon after their first wave actually were hit harder in the fall. And here we are again with a pandemic that comes in the springtime, and healthcare officials warning about the fall being even worse during flu season. So how are you wargaming that out? I know the president incorrectly said that it probably wasn't going to come back at all. Every health official says it will. So how are you wargaming confronting this pandemic at a time when hospitals are also going to be overrun with those suffering from the seasonal flu?
Now, this is something, Joe, that we think about and act on all the time. As a country, we were caught flat-footed going into this. So we know one thing: we can't let that happen again. So just last week, I visited a new field medical station in Atlantic City built by the Army Corps of Engineers, and they've been fabulous, by the way. I looked at a reopened wing of East Orange General Hospital, another 250-something beds, similar in Paramus, New Jersey. Those are capacities. By example, we just finally we're able to find and legitimately buy 500 ventilators, not from this federal stockpile, but for ourselves. We're constantly glomming personal protective equipment around the world. We're building the ranks of our healthcare workers for the very question you've asked. We want to make sure that we're never caught flat-footed again, so that we've got our own stockpiles, our own capacities, our sufficient fully ranked core of healthcare workers. And that's, for us, those are the steps I know we could take. I hope the feds will take similar steps, but those are steps we're taking explicitly for the question you asked. Based on any history, the chances are overwhelming that this thing's going to come back on us. We can't be caught flat-footed again.
We've got to learn how to live with this over the next year, year and a half before that vaccine comes, if it even comes then. Jonathan Lemire with the Associated Press is with us, Governor, and he has a question for you. Jonathan.
Good morning, Governor. Good to see you. We were discussing on the show in the last hour about Attorney General William Barr, who said in a recent interview that some states' stay-at-home orders, their restrictions on the economy and on schools and so on, were going too far and resembled house arrest, in his opinion. And he threatened, potentially, that the Justice Department would step in. So my question is for you. Have you heard anything from the Justice Department along those lines for what you have in place for your state? And perhaps more importantly, if you do, what will your response be?
Yeah, Jonathan, I've heard nothing. And if we do get something like that, and we still believe it's the best course of action to protect the 9 million folks who live in our state, we will meet them in court. I mean, there's no other choice. But an interesting, with all due respect to the Attorney General, an interesting poll came out last week, and it asked, among other things, has New Jersey gone too far or not far enough? And it's worth noting that of the folks who thought we went too far were more than doubled by those who felt we had not gone far enough. So the overall majority agreed with what we were doing, but even the minorities on either end was clearly tilted toward, if anything, go further. Folks are smarter than we give them credit for. If you flip the light switch today in New Jersey, without the testing, broad-scale testing, and we've come a long way on testing, we still need to go a long way. Without that in place, without contact tracing in place, without an isolation plan in place, without clear parameters, nobody's going to show up. Folks are smarter than we give them credit for, and they're smarter than the Attorney General gives them credit for. So I'd say, with all due respect to him, if we don't think it's right, we'll see him in court. But more importantly, the people don't think he's right. And those are the folks I've got to protect.
Governor, thank you so much for being with us, and thank you for speaking that truth. You look at any poll, and it shows the overwhelming majority of Americans, even Republicans, support these guidelines staying in place for several more weeks. They understand, just like the governor said, Mika, we're not ready to open until we have the type of testing that Dr. Fauci and Dr. Birx were talking about.
Thank you, Governor, very much. And coming up...
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.